welcome to today's presentation. My name is Claude. I'm a new graduate nurse. I went to UBC of Nagan for nursing. You can see on the pop I didn't use the word registered nurse simply because I haven't written my nursing exam, and as far as I have not written that exam and passed it, I am not allowed to use the word or the title registered. So that's why you see I put the Bachelor of Science in Nursing. Well, today's presentation we'll be talking about caregiving or caring, and we'll see how caregiving or being a caregiver can change someone's life and can also have a positive impact. So we'll go through some definitions to start. A caregiver, really the definition is already in the word itself. A caregiver is someone who helps another person who normally this person would be able to do things for himself or herself, but because of some illnesses, long term, short term, or because of some accidents, life limiting circumstances, they are not able to do the things they would normally do for themselves. And so now they're requiring help from another person. They're sort of depending on the other person to be able to do most of the activities for them. Um, and caregiving is the act or the way of looking after another person in terms of like providing care for them. And because caregiving or involves a lot of people who have chronic illnesses, I thought I would put in a definition as well for chronic illness. Uh, Chronic illnesses are conditions that mostly will last more than 1 year or longer for the most part and require constant medical attention or will limit the ability of a person to do activities of daily living. When I say activities of daily living, this include um, cooking, like going to the store, grocery shopping, um, personal care. There's a lot to what activities of daily living could include. Um, so caregivers, although I'm saying we because I feel like I'm one of them. Although caregiving can be very, very impactful to the person you're giving the care or looking after, there's some challenges that come along with it. And one of the challenges is the nature of the patient's condition. Sometimes you are faced with a condition that you are not familiar with, and this is really key, um, like to family members looking after um, a loved one, especially if the family member or whoever looking after the person doesn't have any medical background, and so the condition of the person and being unfamiliar with it and not knowing what to expect is a big challenge when providing care. Uh, and alongside that comes conflict with family members. So in a family of like 4 or 5, depending on how many people are in the family, so the size, depending on how many people are there, you will see that one person would probably be like designated to be the primary caregiver, and usually that is burdensome to that one person because you also want to have some time off to sort of decompress, relax, have a peace of mind. So when that doesn't happen because no other family member is wanting to or is willing to look after the loved one, then you become like the only sole person to do it, and that can be burdensome. Another challenge is personal life. you as a caregiver have some other stuff going on in your life. You still have to go to work. You probably have a family, and you have to spend as much time as possible with your family. But because you're looking after this one person, it becomes a challenge because you're trying to sort of like divide time between when you're going to be with the patient or the person you're looking after, time for yourself, and time together with your family. So all those aspects will be challenge will play a role in like causing challenges as a caregiver. And the other one is gender barriers that come along with caregiving, especially like in a family context. Say, for example, um, if you're looking after a parent, like you're a male caregiver looking after a female patient, that is really, really uh, tough when it comes to personal care. So I just go through each one of these four challenges. I've probably have spoken more about it, but we'll just go one at a time. Um, so the nature of the patient physical condition. The health status will change suddenly for some people. Like if a person has like dementia, they will forget pretty quickly. Or if the condition is really painful, they will like pain will just start at any random time. And all those emotions that happens will be unexpected, and so they create a big challenge in terms of like looking after the person you are caring for. So like things like I've mentioned, like sudden increase in pain, or they suddenly start feeling unwell, or they start to deteriorate in terms of like mental status. So today they would normally remember things that happened in the morning. Tomorrow they won't be able to remember, or you probably have said this so many times to them, but a while after, half an hour, 2 hours later, they can't even remember what you said. So all those stuff, the nature of how things change, health status, mental status, all those will create challenges because then you're like, it sort of like, let's say, for example, they have dementia and you're looking after them, and you've probably told them at this time, or so and so was here to see you, and then later, 2 hours later, they're like, uh, I really miss Gloria. I wish Gloria was here. Oh, you're like, no, Gloria was just here. You know, so when that happens, it creates frustration. It also makes you feel sad seeing the person how like a moment ago they were well, they could remember, and now they can't remember. So things like that. And then the second challenge we mentioned was conflict with other family members. Different family members will have different views on what is best care for the person. You probably think I'm doing the best for this person. The other family member will probably think, oh, I can do better. Or they will just have completely different mindset in terms of like what is good care for this one person looks like. Uh, and I had mentioned about who, like dividing time between who's looking after the person today or tomorrow or later today, like dividing time between family members. This is more if it's a loved one and the whole family is looking after this one person. So there's like a disagreement on whose turn it is to assume caregiving roles. Oh, I have an appointment I have to go to, but it's your turn to look after this one person. So I have to pull someone else to come in the role. So a lot of mix and match in terms of like could work, couldn't. The many caregivers there is, the better for the most part because then it's not just one person looking after this patient or this loved one. You also, when that is the case, you also have time to relax, to decompress, to have time for yourself or spend with other friends. But if you're the sole caregiver, then you don't have the luxury of switching roles or like having someone to help you, and so that can be really burdensome. So in some ways, the many members that are looking after a loved one, they're better, but there's also that one part where disagreement can take effect. Um, and sometimes the stress is not just because you have to look after this one person, but because of the conflict that is arising between family members and on who's to do what, who's to look after the person when. So all that stuff play a role in creating the challenge that we see with caregiving. Uh, Personal commitments or stresses. So beside being a caregiver, you like before becoming a caregiver, you probably had or have a life of your own. So you had activities to attend, you had work to go to, and other things to do. And so, and when you add caregiving to that, the stress is even higher. And so, and when all that is conglomerated together, it becomes a very, very challenge in terms of like dividing your time, when to be with the person you're looking after, spending time with the spouse if you're married, or spending time with friends if you have a big social network or social circle, um, and seeing your parents. And work duties are still there. You still have to be able to provide for your family or have some sort of income for yourself. And so all those stresses, they, they become a challenge for caregiving. Um, and then, like I was mentioning, gender-based barriers to caregiving. I mentioned like if you're looking after your mom and you have to provide personal care, caregiving is a very intimate role. And so when you're giving the care to the person, if you're a male providing care to a female, it is different if the person is someone else who like you are employed or you are paid to look after this one person. It's different. But when it comes to your mom, if you're a male, or dad if you're female, and be able to, and you are required to provide personal care to this uh, loved one, it can be awkward, it can be challenging. So all that is a challenge that we see with caregiving. And some cultures only see caregiving as a female role, and that is not true. There should be education around that because anyone, whether female or male, can look after someone. So, but some cultures, like Canada is diverse, so there will be cultures that will still view or regard caregiving as a female role. So having that in mind, and um, it's going to help in terms of like determining where exactly do we go from here, what do we do. Um, I'm going to give an example like on gender-based barriers that I've seen, like that I personally have come across. When I when I was working as a care aide, or even to this day in the hospital, some patients will tell me, like if some female patient, to be specific, will tell me, "Can I have a female nurse? Actually, I'm more easy with a female patient than with a male nurse. They will say that. And to be honest, I don't take that personally because I understand like there's that stereotypical um, view where that nursing was just meant for female and not male. And nursing is like 80, 85, probably to 90% just female. So yeah, some people will be okay with their gender uh, caregivers, and some others won't matter, and some will just be okay. If they're males, oh, I just want a male caregiver. Or if I'm a female, I just want a female caregiver, and so on. So just having that in mind and not taking things personally will help you sort of like know what to expect. Because once you know what to expect, it's easy to get over the bump um, than not knowing and finding out, oh, this is what it is. And so caregiving, for the most part, has a lot of positive aspects around it. But we'll talk both negative and positive. I hope the message here on the negative side is not that you don't see the beautiful, the positive part of caregiving. I'm going to talk about, I think I have a few slides on negative impacts, but there's also positive impact. So don't really dwell too much on the negative aspect, but also see the positive. Um, so there's a lot of variety of emotions that caregivers go through when providing care. There's worry, frustration, and the mood changes. It's like it changes around the clock. So first, you worry about the patient's safety, their well-being, and the constant worry of their safety, their well-being. All this creates some sort of stress, which lead up to reduced sleep. And when you don't sleep enough, you don't perform effectively, and that can actually impact on how like the quality of care you're providing to the person. And these are normal to go through as a person because you don't want to be sleeping or like being there and not worrying about the patient, because then if there's no worry, then there's so then like how do you actually care for this person, you know? And then you will feel frustrated for sure at some point, especially when you are in a situation that you're like, what am I gonna do? You know, like there's a lot of times where things happen like I don't know what's the best course of action to take here. So all those times create frustration, or you're looking after someone who can't even communicate with you. They are non-verbal, or they're verbal but don't speak the same language as you. So because of that communication barrier in between you and the person you're looking after, um, frustration occurs. And then you have times where your mood is like in is changing, where like and that this is usually relates to the patient conditions. If the patient condition changes a lot, your mood will be changing a lot. If it changes like relatively slow, your mood is going to be probably the same. If the patient is happy, you're going to be happy. If they start getting unwell or start getting painful, you seeing that, you being there, you're like experiencing it with you're experiencing that with them, and so that will affect how your mood changes or how you feel at that moment in time. You also feel sad, and this is more prominent when you know that the person you're looking after doesn't have as many days left to live. Say, for example, if they're a cancer patient and they have like, you probably know they don't have more than a month. And so knowing that in your mind, yeah, it creates some, it makes you feel sad. Um, or if they're dementia patients, not able to remember things that happened, uh, also makes you feel sad. There's a feeling of ambivalence, and what really this means is that you really don't want the person looking after to die, but when you see how they're suffering or how they're progressing in their stages of with the illness, you actually wish maybe if they die, this is going to be better because you don't want to see them suffering all the time. Um, and then with all this, there's high levels of depression and anxiety. That's like big point in all of caregiving. Depression and anxiety is there. It happens quite frequently and often. And then when you're looking after someone, you're more focused on looking for that person, but you are also forgetting to look after yourself. So your physical health, your mental health sort of becomes secondary, and your patient's health becomes primary. So you are not self-reporting your health status. You are missing your appointment sometimes, because remember, you still have life to live for yourself. You still have to be able to go to the doctor's appointment, to do some other stuff for yourself. So finding that balance is important. But mostly when you're looking after someone, your patient becomes a primary concern, and everything else is secondary, including yourself. From the studies that I went through when making this PowerPoint. And then with high levels of depression, anxiety, or stress, and then your immune system becomes compromised. And this is because high stress levels it affect on how your immune system responds. Because your immune system doesn't really work well when your stress levels are high, because high stress is known to decrease your helper T cells, which are very, very important in terms of like fighting infections, and hence the compromised immune function. Uh, and those are the negative parts of caregiving. There's probably more, but those are like the main points. But enough about negatives. These are the positive impact of caregiving, which are the ones we really like, and probably the reason why we choose to be caregivers. Or well, some people don't choose to be caregivers. Just happens that a family member becomes sick, and because of financial hardship or just wanting to be helpful, they choose to become caregivers. And that, like this quote that I found on the internet by Charles Dickens, it says, "No one is useless in the world who lightens the burdens of another." Uh, Bear in mind that the person you're helping isn't there because they want to. Like this person was able to do the things you're doing, like you're helping them with for themselves. So if you're there to help them, you're really doing really like great stuff for them. Because assume like thinking that like if this person was able to do this and they're in a place where they actually can't do anything for themselves, and you being there to help them, it goes really a long way. So those are the main reasons why caregiving is really impactful. not only to the person you are helping, but also to you, because there's a lot of things that you develop in caregiving, and we'll talk about that like shortly, um, that are very beneficial to you as a person and to the person receiving the care. So one of them is a sense of fulfillment or satisfaction. The experiences you go through will make you feel fulfilled and will enrich the lives of those you are looking after. I've said already, like the person you're helping will be really grateful for what you're doing for them, but also the fact that you are helping them, it helps you feel some emotions that are really fulfilling. Um, Good for your body, good for your health. And then there's the extension of social networks or friendships really relating to caregiving. You build a bond. I mentioned this earlier that caregiving is very intimate. So the friendships you're gonna build, the bond you're gonna build with this one person you're helping, or however many persons you're helping, their social network, their social circle also becomes yours. So all that is like not like after the like once the relationship between you and the person you were looking after is over, it won't necessarily means that your relationship with the social network of the person you were looking after is done. No, it goes beyond that. The friendship, the bond will always go beyond that. Uh, it makes you feel useful and needed. Another reason to feel fulfilled when providing care or when you're being a caregiver. Caregiving also allows you to discover yourself. It also allows you to discover others. It helps you understand the meaning of life. You start to appreciate the little things that we take for granted in our day-to-day lives. You appreciate your health, family ties, and you also find a purpose or determination in living life to the fullest. You say, "Oh, I see this person can't do this anymore. I have to. I need to get back into doing this, or I have to do this because once I'm in this stage as well, I won't be able to do it." So it helps you find your purpose or determination to living your best life. Um, some more positives. Your perception about life changes. You start to realize that there's a lot of things about life that are different that happens that like that makes you feel like, oh, so this is where we're going, so this is how it's going to be. uh, you go through like, and everyone, and I mean everyone, we will all go through a process where at some point you're going to become weak and ill, regardless of your strength, your social status, or economic class. However rich you are, however famous you are, and however strong you are, at some point you're going to be weak, you're going to be ill or sick, and you'll need some help. So once you realize that, your perception about life changes. Uh, Caregiving helps refine your character. You develop your personality by becoming more patient, resilient, and stronger. Because without resiliency and patience, caregiving is unlikely to be something that you can do. You have to be patient. You have to be resilient because the person you're going to be helping, will probably need you to be more patient and resilient for the most part of the time. You also develop strong coping skills. You've been around someone who is sick, someone who's going through life-changing experiences, and so you seeing that day to day, being there with them, you develop coping skills. Your knowledge also increases in and your skills in caregiving as well. Uh, if you're looking after a loved one, your family closure develops really even deeper. You become really close with your family. Um, and as you can see, there's a quote on the left side here that says, caring about others, running the risk of feeling and leaving an impact on people ultimately will bring happiness. And that is true for sure. And those are the positives of caregiving. For me, the positives of caregiving outweigh the negatives. And so, if you're to become a caregiver, don't dwell too much on the negatives, but see the impact you're causing or doing to the person you're helping. We'll talk more on the caregiver syndrome. Basically, this is just like caregiving stress. It is true, stress, like caregivers experience a lot of stress. As you can imagine, when you're looking after someone, you are going to experience a lot of stress. And that is not to say that you shouldn't become a caregiver because of stress. Everything in this world, I feel like, creates stress. Going to work is stressful. Uh, Thinking of what to eat today for some people is stressful, because especially if you don't know exactly where that is coming from. So a lot of things in this world are stressful, and so in the caregiving world as well, there's stress. Essentially, caregiving syndrome, it is the burden of exhaustion, anger, and guilt that is experienced when you're providing care to someone. And this is more prominent for those who are looking after an individual with behavior difficulties. So maybe say the person we're looking after is really aggressive. He wanders or she wanders too much. In a blink of an eye, you probably won't know where they are, and you have to start looking after them. Have memory issues, mostly seen with those who have dementia. So things like that. Uh, I'm just gonna focus more on this because it is an area where um, caregiving sort of becomes like people like instead of like continue to be caregivers, they will probably um, stop or leave the role because of the stress that is in the caregiving role. But I want to talk about the signs and symptoms because if you know the signs and symptoms of that, you are probably going to find out ways to cope, ways to deal with that, and hopefully you're going to stay in the role longer and continue to impact the lives of those you're looking after. So some symptoms include fatigue, lack of sleep, depression, anxiety, or irritability, um, reduced appetite. Uh, you're probably going to have unwillingness to seek help. You will feel burnt out, and you probably start overreacting to minor issues. You feel fatigued because you are constantly worrying about someone or looking after someone, and you have to be there for them. Probably don't have time for yourself, or don't have enough time for yourself. You are lacking sleep because you can't sleep because you're worrying something might happen to the person. So you have to stay awake to so that they're safe. You are concerned about their safety. Uh, so overall, the stress builds up, and for however long you're in that role, the stress level, you feel depressed, you'll be anxious, and with that, you won't feel like they need to eat. Uh, you probably won't need. You probably won't be willing or be reluctant to seek help. When people ask you, "Can we do anything for you?" You're probably gonna be dismissive and be like, "Oh no, I'm okay." Things like that. The things that would normally be irritating to you, you'll start overreacting to them. Uh, you probably start to lose some interest in things you used to be interested in. And then your immunity becomes decreased. I've talked about this. Your stress levels build up, uh, which i- which affects your immune system because in high level of stresses, your immune system doesn't work well. So the ability for your immune system to fight infections decreases. So you become prone to infections. At some point, you're gonna feel hopeless. You start to withdraw from your friends or family. So no more social interactions. And the more there's no social interactions, the more prone you are to suicide and stuff. Um, Emotional and physical exhaustion, weight loss or gain. Weight loss if you're not eating too much, gain if you're eating too much. Um, and then there's some strategies that you can do to deal with the stress or the caregiver syndrome. Seek and accept help by identifying ways people can help you. You can focus on what you're able to provide, like understanding that you can't just be, like understanding that what you're doing for this person is the best that you can do for them. You also can set realistic goals, uh, things that you are able to accomplish. You don't have like too many tasks that you won't be able to accomplish. Get connected. Find ways you can. Maybe there's a support group for caregivers. Getting involved. Um, Being able to self-check and go for appointments to the doctor and talk about it. Embrace your caregiving choice. Like you went into this willingly. There was a good reason why you went into it. And looking for ways that brings you closer to the person you're caring for. Uh, and celebrate the small victories. It goes without saying that appreciating the small tasks you complete and not just dwelling too much on what you didn't accomplish. Um, Eat healthy, get enough rest, exercise, find time to relax. All those ways will help you feel good. Uh, and that is really it for this presentation. And those are my sources for the presentation. I'm gonna leave it now to Glory to take over for some questions if we have any.
Thank you, Claude, for that presentation. Thank you for your time. Thank you for your wisdom and the info that you gathered for us. Um, Pretty sure some of us took what we could from what you just listened to us. If anyone has any questions, this would be a good time to ask them. If you have any questions, you can maybe raise your hand or just unmute yourself and ask a question that you might have. Um, I had one. If no one has, my question was pretty simple, but you mentioned a lot there being like a lot of stress in this field of work. I was wondering, like for you personally, like what do you do to combat or balance out the stress from the anxiety, the tiredness? Like what do you do to help in that area?
That's a really good question. Personally, I like especially right now, like I go hiking a lot. I try um, to go in the wilderness and try to appreciate nature. But another thing I do that is probably not seen as a way to deal with stress, but I try to leave work at work. So once I step out of the hospital, whatever happened, they happened there. When I leave, okay, I gotta go and live my life. Like I'm like someone who didn't go to like who didn't work today, you know. So try. Well, it's hard to just forget about it, but you have to have the courage and make it a habit, sort of like to say, okay, I'm out of the hospital. I don't want to talk about work. It's done. It's done. So and so said this, or today was busy. It was just stressful. That's it. Uh, or finding like knowing someone who also does the same thing that I do. Maybe we just you talk about it. It helps.
Hmm. Hmm.
Yeah.
Thank you for that answer. Um, if no one else has any questions, uh, well, yeah. Once again, thank you for your time. Thank you for the presentation, and we are going to be hearing from you in the future. So,
I have a
Boniface has a
question.
question.
Yeah. Uh, when you say like when you out of your work, you forget about it. So does that mean that you don't do researches about your work, or like do you hate your work? Is it like why do you just forget about it?
No, it's not when I say forget about work, it's not that it's not to say that I hate work or I don't do research. Like if I come home and do research, I'm gonna do research on probably a condition, looking like how does the body react to this condition? Like what does the patient go through when they have this condition, and how can I help them while they're in my care? That's the kind of research maybe I can do. I'm not gonna come home and do a research on like, oh, okay, that person was rude. How to react to a rude person? No, I'm not gonna do that. When I say forget about work, is for me to try and forget about the negatives about work and focus more on the positive side about my work. That is what I mean.
That was a nice, good question from Boniface. Does anyone else have a question?
Yes, I have one.
Okay, you can go ahead.
Yes, first of all, I say thank you very much, Mr. Claude, for the presentation. One thing that I want to know is during this moment of COVID and the work of caregiver, did it increase the burden? Did it helps? How did you cope with the restriction imposed by the government and with the service that you have to offer during this COVID period? I want to know if it was easy or it was very difficult for you, for the caregivers.
Um, Personally, well, I can only say that pandemic made caregiving even more difficult because caregiving is just difficult on its own. So having a pandemic makes it even worse. But I have to say that hospitals around the province really they did a good job in terms of initiating protocols that people have to follow while they're in the hospital. And I'm only talking about the hospital or long-term care because that is only where I've worked. Like I haven't worked in like someone's home, so that would be different. But I'm saying like in terms of like hospital, Like you as a visitor, you have to wear a mask at all times when you're in the hospital. If you're a patient in the hospital, excuse me, like here where I work, if you're in your room, it's okay to not have a mask on. But if you're getting out of your room into the common area, you have to have a mask on. And so having those protocols in place and having the masks available, because if you have that protocol and there's no mask, then there's nothing. But for me, I feel grateful for what the hospital did because people um, were good to follow the uh, the instructions that were put in place. Well, it's hard in on the other hand because it's nice when you put a face, um, when you can know like who's looking after me. Like people like, oh, what do you look like, you know? And then you have to present your eye like, oh, this is me, you know? Like it's hard because you want to know who's looking after you, who you're looking after, and that kind of relationship. But for the most part, it's been good. I just want to say thank you for all of you for being really good listeners and hearing me go through a lot of information. But thank you for your questions and for listening. So thank you so much.